Welcome to the Medicare MSA comparison. What we're going to do today is explain why 85% of seniors should have an MSA, otherwise known as a medical savings account. These are a very unique programs in Medicare. You have several options in Medicare, and every choice that you make in Medicare will have a trade-off of some sort, and that's what you need to understand. Your choices are Original Medicare A and B, and then have a Medicare supplement along with that, or you could have what's called Medicare Part C. That is also known as Medicare Advantage Plan. Or you can have a Medicare Part D, and that is known as the Medicare RX plans or prescription plans. So those are really all of your choices when you have Medicare. Do I want original Medicare A and B? Do I need a supplement to go along with that? And if I do have a supplement, what kind of supplement should I take or have, and what are the differences? Or do I forego that and say, what are these Medicare Advantage plans? I would rather have a private insurance company. And that's what a Medicare C is a private insurance company, not original Medicare A and B. And then again, how do they fit into your prescription drugs? And that's what we're going to take a look at is all of your choices and the trade-offs of those choices. But before you can decide on which plan is best for you, you first actually have to understand what is the definition of insurance. It all comes down to what do you get for what do you pay for? What is my insurance? What are you trying to accomplish by buying the insurance? Insurance as defined is a transference of risk. You are the insured. You pay a premium to an insurance company to transfer the risk of having to pay for medical care to the insurance company, and the insurance company is willing to accept that risk. The insurance company accepts the risk in hopes of making a profit, and they do that by spreading the risk over a large population of insureds, large groups of people, and that's what your insurance company is looking at when they decide to bring you on as a client. Again, there's several different parts of Medicare. We'll first look at Part A, which is your hospitalization. So you have Medicare Part A basically as one of your retiree benefits. So Medicare Part A is an inpatient hospital insurance plan, and it covers your inpatient hospital care, your skilled nursing facility, hospice care, and some home health care. But basically, to understand it, your Medicare Part A covers your hospitalization. Most people will be automatically enrolled into Medicare Part A when they turn 65. If you elect not to receive Social Security benefits, you won't be automatically enrolled at age 65. You might actually have to go onto the Medicare website and enroll, and we can certainly help you do that as well. And Medicare Part B covers your doctors. Also covers inpatient care, some durable medical equipment. This is like wheelchairs and crutches, hearing aids, things like that. It covers your preventative services and some home health care. Medicare Part B does have a premium. That premium is paid directly to Medicare. Whereas in Part A, most people don't have to pay a premium because they work their whole lives and qualify for Part A. But most people will have to pay a Part B premium, and that premium is based off of income. So it's a sliding scale. The more you make, the more you pay for your Medicare Part B premiums. As you can see here, most people will fall in the $91,000 or less. They would pay $170 a month for their Part B premium. Again, so you have a Part A, you have a Part B, you enroll in Part B, you have a premium attached to that. Medicare Part C's are Medicare Advantage plans. What these are plans sold by private insurance companies. These are the several companies out there like Humana and United Healthcare, Aetna. There's literally hundreds of companies out there selling Medicare Part C plans. So these Part C plans are called Medicare Advantage, and there are several different Medicare Advantage type programs. You can have the PPOs, you have HMOs, you have fee-for-services, you have special need plans, and the medical savings account plans. Those are all programs offered by private insurance companies underneath the Medicare Advantage umbrella. So if you have a Part C, then you have a Medicare Advantage program through a private insurance company. That means you do not have Medicare A and B that will be paying for your health care. You have a private insurance program. And that is the differences between Original Medicare A and B with a supplement, and Medicare Part C, which is Medicare Advantage plans. To be eligible for a Plan C, you still have to be enrolled in Original Medicare, and you still have to be paying your Part B premiums. Now, the difference is Original Medicare A and B, again, are not paying your health care cost. Your Plan C is, or whatever insurance company you're with on the Medicare Advantage plan is paying the bills, but you still have to pay your Part B premium. And you have to live inside their service area. So the county that you live in will have Medicare Advantage plans approved in that county, and you can enroll in one of those programs. Medicare Part D are your prescription drug plans. These work in conjunction with all the other parts of Medicare A, B, and C to give you prescription benefits. And there are, again, several of ways to incorporate these into the original Medicare A and B with a supplement or your Medicare Part Cs. But basically, those are the four programs that are available. You have Medicare A and B, which is original Medicare, and you buy a supplement, or you have Medicare Part C with a integrated Part D program, or you have a standalone Medicare Part D along with it. These are all the options that we'll go over in detail shortly. Choosing original Medicare A and B. If you choose to have Medicare A and B, it will cover approximately 80% of your health care costs at your hospital and your doctors. It will not cover prescription benefits, though, so you will have to pick out a separate standalone Medicare Part D prescription plan. But again, original Medicare A and B is designed to cover about 80% of your health care costs through your hospital and your doctor, and you need to pick up a separate prescription drug plan called Medicare Part D. Now, because Medicare A and B only covers about 80% of your health care costs, you should also look at picking up an additional Medicare supplement. And what is a Medicare supplement? Well, it's exactly what it sounds like. It is a supplement to your original Medicare A and your Medicare B. It supplements those programs. The great part about Medicare supplement plans is they're standardized. And what that means is, let's say a Plan G through company ABC, well, it will cover the exact same benefits as, say, company DEF. There is no difference in the coverage. They are standardized by the Center for Medicare Services, or CMS, so all Plan Gs will cover the exact same thing as any other Plan Gs. The only difference in these programs is the pricing can fluctuate. And that's what you, again, want to look at when you're evaluating what program's best for you. And now that you know the plans that are sold by these insurance companies are standardized, so everybody's Plan G is the same as every other Plan G. If you look at comparison here, this is actually in the zip code I live in, which is 85086 here in Arizona. A 65-year-old non-smoker, a Humana premium would be $148.70, Aetna would be $152.94, Mutual of Omaha $159.79. And again, you can shop and get comparison and actual coverages if you click on that link below to shop these programs. But this just gives you an idea of what is out there when you're comparing the plans and evaluating what is in your best interest. Take a look at all the programs, take a look at the premiums, so you can make an informed, intelligent decision. Medicare Part D are your prescription benefits, whereas Medicare Part A covers your hospitalizations, Medicare Part B covers your doctor's office visits and durable medical equipment. Medicare Part D covers your prescriptions. These are offered by private insurance companies just like your Plan Cs were. So you'll see Humanas and the Aetnas and the United Healthcares of the world and Blue Cross and Blue Shields. But Part D is sold by private insurance companies, and they cover your prescription benefits. Here's an example of a couple of Medicare Part D programs. Here's Walmart, Humana's Walmart plan. It costs $30.60 and has a $505 prescription annual deductible. The Aetna one, again, is very similar. These are sold by private insurance companies. For these particular plans, you can click on our link below here to our website and get complete details. But when you buy original Medicare A and B, you need to also add a supplement to it, or Part D as well. So you have Medicare A, you B, you buy a supplement, and you have to have a Medicare Part D as well. So this gives you an idea of the whole package that you'll be purchasing. Now we'll discuss the Medicare Advantage plans. The Medicare Advantage plans, again, are the Plan Cs of Medicare, and they're offered by private insurance companies. You pay a premium to these insurance companies. Most of them, Medicare actually pays the premium on your behalf. But again, these are Medicare Advantage plans, or Plan Cs sold by private insurance companies. Now, the different kind of Plan Cs are your private fee-for-service plans. There's also what's called preferred provider organizations. There's HMO and POS, which stands for point of service. The SMP stands for special needs plans. Those are people with like diabetes and chronic illnesses. And there's some plans that specialize their coverages to help those people help pay their medical bills. And again, the very last one is the MSA, or the medical savings account. Here's an example of PPO programs that we offer. For complete details, please click on the link below the Medicare Full site and go and get a complete comparison to these programs, so you can see exactly what they cover. But to understand what a PPO is, again, it's a preferred provider organization, and you, the insured, you're given an incentive to use a certain list of doctors and hospitals. But you don't have to. You can go outside of your network, but that comes again with a consequence. And that's what we originally talked about, is you have choices and trade-offs. So what you'll see is that Aetna, if you go outside of the network, you're allowed to do that, but your out-of-pocket jumps from the over 5,000 to over 8,000, and on the Humana from 6 to over 12,000. So you're penalized for not going to doctors and hospitals on the list. But if you look at it, if you have a catastrophic illness, for example, and you have survival rates better at, say, MD Anderson or Cedars-Sinai or Mayo Clinic, and you'd like to go there, having a PPO, you can go there. It's just going to cost you more. And that's, again, really what a PPO stands for. A list of doctors you're encouraged to go to for the savings, but you're not obligated that you have to go to those list of doctors and hospitals. And here's an example again of HMO programs. Again, there's Aetna and Humana. We'll take a look at those. You can get a comparison again on our Medicare Full site. Click on it and look at the exact comparison of what covers. But again, this just gives you an idea. What you're going to see on the HMOs is that stands for Health and Maintenance Organization, and this is the programs where you must go to doctors on the list. You don't have an option like a PPO to go outside of the network. And you'll see that the out-of-pocket maximums are going to be lower on the HMOs. And again, that's because that choice and trade-off, you're trading off lower deductible versus higher deductible by having ability to go outside of your network. So you can see the Aetna here is 3,050, the Humana is 3,400. Again, these are very, very similar programs. They're both phenomenal programs for people. But again, this is the choices that you have to look at. Is if you want an HMO, understand that you're going to have to go to doctors and hospitals on the list for your health care. Lastly, we'll talk about the medical savings account, or the MSA. Now, there's only one company even offering the MSA in the majority of states. They're only in 37 right now. But this, again, is a very, very unique plan. But you can see you have, again, a deductible here. You have an out-of-pocket. Again, to get an exact explanation of what's covered or what isn't covered, click on the Medicare Full site down in the left-hand corner there, and you can actually get a comparison to all the other programs out there. But the reason we like this one, again, is there is no network of doctors and hospitals, and that is very important here, is you can go to any doctor or hospital underneath this program that accepts Medicare. And that is a huge, huge difference between whether it's a PPO and HMO. The MSA, no doctors or no hospital networks. So again, you get to have more choices and flexibility. So what you've seen so far is a brief explanation of what Medicare Advantage plans are, and you can see that majority of them cost no premium, or in the instances there are premium, it's very, very minimal to the insured. And we always get asked questions, well, how is this paid for? And what you need to realize is that Medicare is signing contracts with these various insurance companies to offer these programs, because it's less expensive, and that's the hopes anyway, is that it's less expensive for Medicare to contract out the healthcare coverages. And we'll take a look at some reimbursement rates in the state that I live in. But understanding that Medicare is basically paying the premiums on the behalf of the insured to the insurance carriers. And that's, in a nutshell, boiling it down to the simple form. Now, these reimbursement rates, again, this is in Arizona. You can look at by county, but they're running about $1,000. Again, just ballpark rounded. And that's a pretty consistent throughout the country, depending on where you live. Some are a little higher, some are a little lower. But Medicare is reimbursing these insurance programs or plans at the rate of about $1,000 a month on your behalf. Again, that's why you get inundated with so many sales calls. Is you are worth quite a bit of money to an insurance company. So again, this gives you an understanding of how the Medicare Part C is funded and why the premiums to the insured are low, and it's because Medicare is paying them on their behalf. So now that you've had a kind of a brief understanding of how all of Medicare works, whether you have a Medicare A and a B, which is original Medicare, or you choose to have a Plan C, you understand kind of how the system works. You can have a supplement, you have to have Part Ds, so all this stuff incorporates. So what we'll do now is explain the uniqueness of the actual MSA on how all this works with all of the different programs available to you. So we'll explain the LASO MSA. They, again, are the nation's leading MSA provider. They're the only one really offering the program on a coast-to-coast basis. They're not in every state, but they're in the majority of states now and expanding. But again, this is the LASO MSA. We'll explain in detail how this program works, and then you can decide if it's best for you. We briefly talked about this before. What is a medical savings account? Again, these are part of the different programs that Part C offers. You have HMOs or PPOs, HMO point of service plans, the special needs plans, and the private fee-for-service plans that are available underneath Medicare Part C. And the MSA is just one of those type of programs offered. Now, how the MSA works and the uniqueness of it is because you're over the age of 65, and these comes down to health savings accounts and medical savings accounts, they're all governed underneath the same legislation. Well, you can no longer fund a health savings account once you reach age 65 or eligibility for Medicare. And because you're eligible for Medicare, that means the plan that is sponsoring the MSA, which would be LASO, they are taking some of the funds that they receive from Medicare for basically the covering the cost of the premium, and they must put a portion of that into your savings account. And we'll take a look at what that is, but it's either $2,000 or $3,000 annually. But that's again how an MSA works: is the plan must deposit money into your savings account, but then you get to decide how you get to spend that money. You can save it, you can invest it, and again, it's deposited into your account on a tax-free basis. Your eligibility of joining an MSA, again, you have to be eligible for Medicare, you have to have your Part A and pay your Part B premiums, you have to live in the service area, you have to reside in the United States at least 183 days. Again, this is very typical for all Medicare Advantage type plans. You have to be eligible for them. Again, the uniqueness of the MSA, which is really understanding the differences between every other program out there, is it is the only program that gives you money back. It gives you money every single year in your savings account. It's either $2,000 or $3,000 you will get into your savings account. There is no premium for this, so you don't pay actually anything for having this coverage. But the most important part, in my opinion, is having the choice to go where you want, when you want. You have the ability to access any doctor or hospital that accepts Medicare. Being able to go out if something horrible happens, God forbid, heart attacks, strokes, cancers, things like that, you have the ability to go where you want, when you want. And again, that is the important. No doctor networks or hospitals. But you also have the potential to grow savings, and that is extremely unique in this program. Whereas if you're given a $2,000 deposit, for instance, and you only spend $1,200 or $1,300 of that in a year on your health care, then the remainder rolls over the following year. Another additional $2,000 would be added to it, and all that money is going to earn interest while it's growing. So it has the potential over a period of time to actually grow an asset for you. The other huge benefit to it is because prescriptions aren't covered under this program, you are able to buy a separate Part D plan to go along with this. And that way you have your healthcare coverage and your prescription coverage separated. And I think that's extremely important as well. So these are, again, unique programs. And who likes these programs? Well, again, it'd be travelers because there's no networks. You can go any place you want. HSA fans, if you had an HSA fan program before you were 65, this is the same basically thing. It's a MSA. It stands for Medical Savings Account. Some people call it a Medicare, but that's not right. It's a Medical Savings Account is what it actually is. It's the same thing as an HSA for under 65. MSA is over 65. But it's also for people who have under control chronic conditions like my father. I've switched my father to this plan last year. He has takes some insulin for diabetes, but it's very controlled, and it was cheaper for him to go on this program than any other program out there because of the out-of-pocket costs and the premiums. And I'll explain to that in more detail. But also healthy people. Getting into this when you're young and healthy at age 65 is imperative, in my opinion, when you're first aging into Medicare, because 65 is not that old today. As we get older and become more healthier, this will allow you to have savings built up over time, again, or potential of it. And also, who really likes this is MedSup enrollees. Again, my father, I switched him to this program last year. He had a Medicare supplement up until then, and it just made more sense once his premiums on his med supplement got so high. It made sense to switch him to this program. So again, this is what you want to evaluate when you're looking at all these programs. So the big questions we get here is people understand the MSA, and they understand that they get money deposited from the insurance company into their savings accounts each year, and they want to know, well, what can I use that money for? Because it is deposited on a tax-free basis, and it remains tax-free if you use it for your health care. If you spend it for anything other than your health care, then there's 50% penalties, and you just don't want to do that. But what can you use the money for? Well, the one thing you can use the premiums for is long-term care, and that's huge. You can actually get tax-free money from this, and you can use it to pay for a long-term care policy. Now, the downside of that, if you're spending that money, then you don't have it to go towards your health care deductible. But again, you're going to be spending dollars, so you have to decide how you're going to allocate the money, and that's, again, a huge benefit is you get the money and you decide how you want to spend it. But you can use it for co-pays and co-insurance and deductibles for your Part D plans. You can do it for hospital indemnity plans, critical illness, dental, vision. All that is health care related plans that you can use your HSA or MSA money for, your medical savings account money. It gives you the power to choose. And that again, is an important part and a unique feature of the MSA. Again, this, in my opinion, is the most important feature, is accessing medical care. You have the choice to go to any Medicare-approved provider. Anybody that accepts Medicare, you have the right to go to them. There are no networks. You're not regulated on who you can and cannot see. You don't have any primary care physicians. This is just basically it's an MSA plan. So you have a medical savings account, you have your card, you have a deductible that you have to meet, you're given funds for those. But if anything comes down to, like I said, a catastrophic illness, anything like that, you have the choice to go where you want, when you want, with no questions asked. Here's a brief example again how a actual claim would happen. You actually go to your doctor and he charges you $150, for example. You actually don't pay anything that day because it has to be repriced through Medicare. So the provider will file the claim with the insurance carrier. The insurance company will apply the Medicare discounts. So you get your Medicare discounted service, and then the insurance carrier will apply it towards your deductible. And if your deductible's paid, they'll pay the provider what they're supposed to pay of Medicare approved charges, and then you can use your MSA money to pay your deductible. So that's basically how the flow goes. Is it works just like every other insurance program, other than you don't have any co-pays or co-insurance or any of that other stuff. You just have a flat fee. You pay the first $5,000 deductible. If you have the $2,000 one, you'd pay the first $5,000 of all your medical care at your doctors and hospitals throughout the year. Again, prescription drug cards are different, so we're only talking about your doctors and hospitals and your durable, your Part A and Part B coverages is what you're looking at. That's what's going to be covered underneath this portion of your health care. I think this is actually the most important slide of how you're going to evaluate whether this is a decent program for you or not. Again, the problem with this slide is it's also the hardest for people to understand. In fact, it's even hard for agents to understand. But what we're looking at here is comparing a Plan G over a 10-year period of time, because that's what an MSA is when we talked about the ability to possibly have a savings and build a savings with for future healthcare needs, which is what an MSA is designed for. Is over a 10-year period of time, we're talking about time value money. So if you look at the first column, where top left-hand corner, where it says low utilization. So what we're going to basically do is look at a $500 annual medical expenses. So you spend about $500 a year on average in your for your health care. And again, how can that happen? There's a lot of people say, well, I got a lot more than I got that in prescriptions. Well, remember that prescriptions are not part of this program. They're completely separate. So you're looking at just doctor's office visits, routine stuff, and any hospitalizations or things like that. So this is somebody who's relatively healthy over a 10-year period of time. So say they come in at age 65. So you can see that the deposit in year one, you're getting a $2,000 deposit from the MSA. And in comparison to that, in year one, you would be buying a Plan G from whatever insurance carrier out there, and you're looking at about an average premium of $1,440. But what you don't realize when you buy a Medicare supplement is you will have rate increases every year. You're going to get at least 3% because of what's called age attainment, and then there's claims history, but they go up pretty regularly every single year. So again, now you look at year two, you got another $2,000 deposit and so on and so forth. So over a 10-year period, you would have $20,000 deposited. But on the Plan G program, as you can see, your rate increases happen throughout your 10-year period of time. Is all of a sudden now you've paid almost $19,000 or $19,895 over a 10-year period of time. So you're looking almost at a $40,000 swing between money that was put in your account and money that went out of your account. So now let's come down right below that. You're going to look at the medical expenses. You can see year one, you had $500. Year two, $520, $540, $560. You never actually hit your $2,000 out of pocket, but over that 10-year period of time, you spent $6,000. Well, if you had $20,000 deposited in your account and you spent $6,003, that's going to leave you the $13,996 left over that's still sitting in your account. Now, if you had those same expenditures underneath a Plan G, you have to take into account for your premiums that you were paying, but now you also look at the medical expense where you have your Part B deductible. So you're paying that $233 every year on your Part B deductible, so you still spent $2,330. So you spent the $2,330 and you spent the premiums, so you spent over $22,000 in premiums and co-pays on your Plan G. Whereas on the other hand, you would still have $13,000, almost $14,000 in your MSA account. Again, we're looking at a significant price swing between what you pay for and what you're getting. And that's, again, the trade-offs that you want to look for when we started this whole presentation. Now, a lot of people say, well, that's fine and dandy, but I have a lot more healthcare needs than that. Okay, well, let's look at high utilization and still look at the differences in outlay. And this is, again, the time value of money. So if you have high utilization, so you still have the same deposits and same cost underneath the top right-hand corner there. So you're going to have the $2,000 deposit. Those numbers stay the same across the board. But now you come down and look at year one, you hit your out-of-pocket maximum. Year two, you hit your out-of-pocket maximum. Year three, you hit your out-of-pocket maximum. Year four, you had a really good year. You only spent $560, but turned around in year five, you hit it. Year 7, 8, and 9, you hit it. So out of the 10 years, you actually hit your maximum out of pocket 7 out of 10 times. Well, again, in a scenario like this where you're fairly unhealthy and you're hitting your deductibles, you're hitting your max out of pockets, you would have spent $36,882. But you also have to take into consideration that you were given $20,000 in your checking account. And that leaves you a total outlay of $16,882 that has gone out of your account. You spent the $36,000, but only $16,000 of that was yours. The other $28,000 came from the deposits in the MSA. Now you compare that again to your Plan G, where you're hitting your deductibles, you're hitting your out-of-pockets. So Plan G is paying for a majority of your health care, so you only have the $233, just like you did in low utilization. So that number stays the same. But the question comes then is what's in your best interest? Would you rather have the $22,000 being spent, or would you rather have the $16,000 being spent? And again, that's looking at this scenario over a 10-year period of time, and we can't predict our health care, so we really don't know. But when you evaluate risk versus reward and the potential gains, this is a huge, huge, huge comparison between the MSA on how you can build an asset, hopefully, and have an upside versus what's the worst case scenario on the downside. Is this going to be about the same as what you'd be spending anyway? And that is the power of the MSA. Now, you've been inundated with a ton of information, and I know we've been bombarding you with all kinds of stuff on here, but hopefully you have a very basic understanding now of all of your different choices in Medicare, whether you have a Medicare A and B and buy a supplement with a Part D standalone prescription, or whether you want to buy an integrated Plan C that has your health care and your prescriptions all in one package. Or do you want to go to an MSA route? Again, this whole presentation was designed to give you a brief understanding of the unique differences in MSA and every other program out there. Here's actually a link that you can click on, and you can download your guide from CMS for Medicare MSAs, just to give you more understanding. So hopefully after this, you'll take a look at the MSA and see if it's right for you. I would like to personally thank you for taking the time to watch this. I know it was, again, a ton of information, but if you have any questions, please call me today, 402-807-2128. I would love to help you with your Medicare choices. Thank you again. Have a great day.